Next, very important is orbital septum. It is a thin sheet of connective tissue. It encircles the orbit as an extension of the periosteum of the roof. This is roof and the floor of the orbit. Superiorly, you can see the septum is attached firmly to the periosteum of the superior half of the orbit margin. At the arcus marginalis, this is arcus marginalis. So this is the septum. It then passes medially in front of the trochlea and continue along the medial margin of the orbit, along the margin of the frontal process of the maxilla and onto the inferior margin of the orbit. Centrally, the orbit septum is attached to the epineurosis of upper and lower eyelid. This is epineurosis, and here it is the attachment. Now this septum delimits the anterior or posterior spread of the edema, inflammation, or blood. The clinical examples include preseptal cellulitis. Anterior to this, there will be preseptal cellulitis. If it goes posterior to this, then it will become the orbital cellulitis. And it also limits retrobulbar hemorrhage. Now, if we cut the orbital septum, what will be posterior? Posterior, there will be orbital fat pads. Orbital fat pads, also known as pre-aponeurotic fat pads, behind the superior septum,